kind of look alike, right? Totally the same.
From the outside, there's a few things that you can identify. We have the apex at the tip, and if you notice, the apex points a little bit to the left. So this is the front of the heart, and that's kind of how you orient yourself when you first get to the heart. Figure out which side's left, which side's right, which is front, which is back. So if it's pointing to the left, you're on the front side, and that is always going to be your kind of way to orient. So if you're flipping this over, that apex is still pointing to the left side of the heart. So that means that we're on the back side. The left, the owner's left, should always be, you know, your right looking at it, because that's more confusing. But all right. From here we can see the pulmonary trunk. So pulmonary trunk, this big tube, and the aorta right here at the top. So pulmonary trunk and aorta. The first branch off the aorta is the brachiocephalic artery. So there's that brachiocephalic artery. And on the model, it's right there. So aorta, brachiocephalic artery. In humans, this is what it looks like. Okay. Other things we can see? These floppy dog ear things, we can see those in the rabbit's heart too. Those are the auricles of the atriums. So this is the auricle of the left atrium. And this is the, back here, the auricle of the right atrium. It's pretty far in the back. You've got the coronary arteries, or these big arteries running along the front. So coronary arteries.
So cool.
No, I'm having too much fun with that. And then the outside covering is called the epicardium. Epi is outside, and it's what makes up the inner part. If you remember, the pericardium was a double-layered sac. This is that inner layer. The main part you pulled off already, but this is that inner layer of the pericardium, the epicardium.
Well, I'll just go over there and take a picture. Is that
All right, moving to the inside. On the inside, we can see the chambers a little bit, some of them. We have the left ventricle is very small. I'm sorry, right ventricle is very small on this heart. Can't even see the right atrium. It was very, very far in the back. So if you look deep inside there, past that valve would be the right atrium, somewhere in there. The left ventricle, much easier to see. So this is the left ventricle, and this is the left atrium. So atrium, ventricle. Atrium, ventricle. Some other quick things to see. We've got the myocardium. It's that muscle that makes out the outside walls of the ventricles. The dividing line between them is made of myocardium, but this is the interventricular septum. It's the septum that divides the two ventricles. Let's see, we've got the valves here. So this one over here, deep inside there, you can see the strings of what's part of that valve. That's the tricuspid, because it's on the right side, it's right to tri. And this big guy right here is the bicuspid. Attached to both of the AV valves, the ones dividing the atrium.
So right is going to be tri?
Yeah, it's right to tri,
And
left is the bi. You gotta try it before you buy it. So the bicuspid here is gonna have all these little strings attached to it. These are called chorda tendini, so heartstrings. The heartstrings are attached down at the bottom to small muscles called papillary muscles. They're kind of tough to see on this heart, but those are the little muscles. We'd pin them just at the base of those strings. So papillary muscles, you can see them on this side too. Down at the bottom of the ventricles, you'll see these crisscrossy muscles. Those crisscrossy muscles are called trabeculae carnae. So trabeculae means that it's, crisscrossed, like a trellis in a garden, and carnae, muscle, so it's crisscrossy muscle. Let's see. Next, when the heart pumps, we're gonna shoot that blood up through this aorta. So we're going from the left side sends it to the aorta. So this is the aortic semilunar valve. Now we can't see the pulmonary semilunar valve on this heart, so I would ask that on the model, or I would have it kind of nearby so you could see That's the pulmonary. So if it's going from the right side out, it's going to go through that pulmonary semilunar valve to the pulmonary trunk. All right, last little bit to know. This is that smooth inside covering. This is the endocardium. It's just like we saw on the outside. It's just the smooth layer on the inside, endocardium. But that's the main important stuff. That's it.
Thank you, ma'am.
You're welcome. Anything you want to see better?